بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة، ولقاء جديد ومعكم الأستاذ المساعد الدكتور صلاح خلف الراوي. موضوع محاضرتنا اليوم هو الجزء الأول من زراعة الأسنان الدنتال implant. In general, dental implant is done for restoration of missing teeth, or a dental implant is an artificial root that replaces the natural root. That means we replace the natural root. So this procedure, it overcome for many disadvantage of other conventional method restoration. Like example, like removable prosthesis or fixable prosthesis. If you look here to this figure, you can see when I compare the roots of natural tooth with the implant it consists from screw type and with that embedded in the bone and implant abutment. This is exposed on in the oral cavity. That means what's the implantation? Implantation is defined as insertion of any object or material which is all nature, either partially or completely in the bone for therapeutic or experimental as a diagnosis or prosthetic purpose. When we come back to the further of implantation dentistry, we come back on the history of implant dentistry. The father of the implant is named Brenmark. This scientist actually have a good said. He said what? No one should die with their teeth sitting in a glass of water. That means this scientist, his goal, we will in the future, maybe he will cancel the removable prosthesis. It is very clear said. So we will come to the advantage of implants. That means advantage of implant, it overcome of draw of the removable prosthesis and give me maintenance or bone maintenance of height and width. Also, the advantage ideally is aesthetic tooth positioning, also improve psychological of health, increase stability and chewing, and increase of retention. Disadvantage of implant: most expensive, time-consuming procedure, not good for patient who don't recover quickly, and adaptation of bone tissue. Surely we need to start this procedure. We have diagnosis and treatment planning in implant dentistry. Patient screening, we need for patient screening and medical evaluation. General examination, we need extraoral and intraoral examination. We need to know classification of arch. We need also to bone evaluation and evaluation of natural teeth adjacent to the implant. Aesthetic risk factor, we need diagnosis imaging and diagnosis cast. We need for evaluation patient medical history like smoker, diabetic, long-term steroid uses, osteoporosis, other disease, and drug radiotherapy. For bone evaluation, in 1988, Mitch classification on bone dentistry, he classified the bone in 4 groups. depend on the region of the jaw, based on where on microscopic structure of the bone. We have four type or four group. D1, we call D1 dense cortical, the location of anterior mandible, posterior mandible, and anterior and posterior of mandible. Type 2, D2, dense two porous cortical bone surrounding dense trabecular bone located in the anterior mandible and posterior of mandible and anterior of maxilla. Type 3 or D3, thin porous cortical bone surrounding fine trabecular of bone and located on the anterior of maxilla and posterior of maxilla. The D4, fine trabecular bone located on the posterior maxilla. And sometimes we have D5, it is immature or non-mineralized bone. As in generally, we have four groups, D1, D2, D3, and D4, like it is very clear in this figure. You can see it. Now we come to the diagnosis tool. Diagnosis tool, we need periapical radiographic, occlusal radiographic, orthopontographic also. We need CBCT, we need cephalometric radiographic. Also we have compute tomography, and magnetic resonance imaging, 3D, and we have interactive compute tomography and photographic or study model. The main goal of surgical imaging to identify disease, determine bone quality and the quantity, and determine implant position, also determine the implant orientation. Now we come to the classification of dental implant in general. We have five types of classification based on implant design. Second one, implant based on attachment mechanism. Third, based on the microscopic body design, and based on the surface of implant, and based on the type of material. Now we will come one by one, so that I will start by on the classification based on the implant design. Based on implant design, we have endosteal, we have super periosteal, we have transosteal, we have intermucosal. When it comes to the endosteal, we have ramus frame, we have root frame and blade form. Root form and blade form and ramus form or ramus frame. Now we come to the endosteal. Endosteal implant. It is a device which placed on the alveolar bone and basal bone of or mandible or maxilla. Transect on only cortical blade. We come to the first one, blade implant. It consists of a thin blade in the form of a blade embedded into the bone. Like see this in this figure, you can see it is very clear here, and then embedded on the cortical bone. Now come to the second one. It is a ramus frame implant. It is a shape, horseshoe shape, and stainless steel device inserted into the mandible from one retromolar bud to the other side. It passes through the anterior symphysis area. Now to the type C, we call it root form implant. It is diagnosed to mimic the shape